experts are raising the alarm over what they call the abuse and misuse of antibiotics. The trend has spiked in the wake of COVID-19 as a growing number of Kenyans wrongly turn to these highly potent drugs without prescription. And as Dorcas Wangira now reports, the experts are warning that this trend could make some diseases more difficult to treat in the future.
Amid rising figures of COVID-19, diseases that have been here for ages have taken on new significance. Flu, fever, a dry cough, sore throat, diarrhea and chest pain. But now this could be a sign of something more serious, and self-medication, which was already a problem, is now rising to a new level, especially with antibiotics.
Mtoto ameumwa, akona homa, naweza pewa antibiotic.
Hii wakati wa corona sisi huwa tunachukua azithromycin ili kujikinga na hii ugonjwa, lakini hatujui ile effects yake.
Mzuri sana. Vile tu watu wamalize ile dose umepewa na daktari.
The trend we've seen is a lot of antibiotic use, both over the counter and unfortunately sometimes even healthcare workers prescribing a lot of antibiotics. Some of it is brought on by fear, the not knowing what else to offer.
In Kabarnet, Baringo, we set out to see just how easy it is to purchase antibiotics over the counter. We pick a random volunteer who has no symptoms or known illness. He walks to a chemist in the town, and in less than 10 minutes, he returns with a common antibiotic which cost 100 shillings for a dose. He says he bought it for a common cold. We ask him if he understands if there is any danger of buying drugs like this. Antibiotics are used to kill disease-causing bacteria, but using them too often for the wrong reasons often enables the bacteria to develop immunity, and over time these drugs can no longer kill them. Experts warning that some bacteria are now resistant to even the most powerful antibiotics available. Dr. Lois Umbajo, head of the Infectious Diseases Unit at the Kenyatta National Hospital, explains why this is a big problem.
This is a viral infection. Antibiotics don't work. There aren't too many new antibiotics being developed. So if we get resistance to the ones we have, then we begin to die of common infections. A pneumonia that should have been easily treated becomes difficult to treat.
According to the Kenya Pharmaceutical Distributors Association, the pharmacist, as an expert on drugs, remains the most important gatekeeper in ensuring proper use of antibiotics. According to Dr. Kamamia Murishu, the chair of KPDA, and I quote, "In the circumstances where pharmacies are run by qualified personnel, be they pharmacists or pharmaceutical technologists, then the patients are in safe hands. However, in our country, a big number of the chemists are run by quacks or other non-qualified personnel who will be putting the lives of patients in grim danger. Medicines are poisons, and as such, they should only be left to the qualified people." End of quote. The Pharmacy and Poisons Board, through Cap 224 of the laws of Kenya, regulates the practice of pharmacy in Kenya, and it is very clear in the law who should handle antibiotics and other medicines which are classified as Part 1 poisons. The law states that these poisons can only be handled by qualified pharmacists and pharmaceutical technologists, and the penalties are very stiff. But the elephant in the room is not about buying medicines without a prescription. It is about abuse and misuse of antibiotics.
That's why it's so important that we only take antibiotics when necessary and when prescribed by a healthcare worker. Even within hospitals, we really have to think about when we prescribe and how we prescribe.
The experts worry that this trend could make diseases more difficult to treat in the future and push the cost of healthcare further beyond reach. And that is why raising awareness about the misuse of antibiotics is very critical. Dorcas Wangira, Citizen TV, Nairobi.